Imagine a child growing up in a home where love is present, but stability is missing, where a parent's attention is divided between their child and an overpowering addiction. Whether it's drugs, pornography, excessive gaming, or any other compulsive behavior, the effects go far beyond the individual. For children, these addictions can shape their emotional health, slow their development, damage their trust, and even put their physical safety at risk. In this video, we'll explore how a parent's addiction silently impacts their kids, affecting not just their childhood, but their future as adults. Because while addiction may feel like a personal struggle, its deepest wounds are often carried by the smallest hearts in the family. Emotional instability and insecurity are among the most immediate and damaging effects children face when a parent struggles with addiction. From a clinical perspective, children rely on a stable and predictable environment to develop a sense of safety and trust. Addiction disrupts this foundation as the parent's mood, behavior, and availability often become erratic. One day, the parent may be attentive and loving, while the next they might be withdrawn, irritable, or entirely absent. This unpredictability leaves children in a constant state of uncertainty, unsure of how their parent will act or whether their needs will be met. Such emotional instability can trigger chronic anxiety, as the child's nervous system becomes overactivated from living in a high-stress environment. Elevated stress hormones like cortisol can interfere with healthy brain development, impairing concentration, emotional regulation, and decision-making skills. These children may also experience sleep disturbances, nightmares, or psychosomatic symptoms such as headaches and stomachaches, which are physical manifestations of emotional distress. Insecurity often stems from the child's perception that they cannot rely on their parent for protection or guidance. This can lead to attachment issues, making it difficult for them to trust others later in life. Socially, these children might withdraw from peers out of embarrassment or fear that others will discover their family's struggles. In some cases, they may act out in school or seek validation from unsafe sources, putting them at risk for further harm. From a doctor's standpoint, addressing this issue requires early intervention through counseling, consistent caregiving from a stable adult, and creating safe spaces where children can express their feelings without fear. Without such measures, the emotional instability caused by a parent's addiction can have lifelong consequences, shaping the child's mental health and relationships well into adulthood. Developmental delays are a significant concern when children grow up in an environment affected by parental addiction. From a medical standpoint, a child's cognitive, emotional, and social growth depends on consistent nurturing, mental stimulation, and emotional security. Addiction disrupts these key factors, often leaving children without the stable support necessary for healthy development. The stress and chaos within the household can interfere with a child's ability to focus, learn, and explore their environment in a safe and confident way. Chronic stress caused by unpredictable or neglectful parenting can impact brain development, particularly in areas responsible for memory, emotional regulation, and problem solving. Elevated cortisol levels over time can weaken neural connections, resulting in delayed language skills, difficulty with academic performance, and poor impulse control. Emotional development is also hindered as children struggle to understand and manage their feelings without proper guidance, sometimes leading to social withdrawal or inappropriate emotional responses. Social skills often suffer in these circumstances. Without positive role models or consistent interactions, children may find it hard to build healthy friendships, work in groups, or adapt to social norms. They may also imitate negative behaviors observed at home, further complicating their ability to integrate successfully into school or community environments. From a clinical perspective, early detection of developmental delays is crucial. Pediatric evaluations, counseling, and specialized educational interventions can help mitigate the long-term effects. However, without timely support, These delays can persist into adolescence and adulthood, limiting educational achievements, job opportunities, and overall life stability. Addiction does not just affect the present, it can set a child back years in their growth, making intervention and a stable caregiving environment essential for reversing or minimizing the damage. Behavioral problems are a common outcome for children living with a parent struggling with addiction, and these issues often emerge as a direct response to the instability and stress in their environment. From a clinical perspective, a child's behavior is closely linked to their emotional security. When that security is disrupted by unpredictable moods, neglect, or conflict at home, children may express their distress through actions rather than words. This can manifest as aggression, defiance, hyperactivity, or, conversely, withdrawal and social isolation. Children in such environments often lack consistent discipline and positive role models. The absence of clear boundaries or reliable guidance can lead to impulsivity and difficulty following rules. In school, this may translate to poor academic performance, frequent conflicts with peers, or disengagement from learning altogether. Teachers may notice these children acting out for attention or exhibiting signs of frustration that stem from unmet emotional needs. On the other hand, some children respond by becoming overly quiet or reserved, internalizing their pain rather than expressing it outwardly. While this may appear less disruptive, it can mask underlying issues such as anxiety, depression, or feelings of worthlessness, which can worsen over time if left unaddressed. From a medical standpoint, these behavioral problems are often the result of chronic stress impacting the brain's ability to regulate emotions and impulses. Elevated cortisol levels can impair the prefrontal cortex, the area responsible for decision-making and self-control. Early intervention is essential, including counseling, structured routines, and stable caregiving, to help children develop healthy coping strategies. Without this support, behavioral issues can persist into adolescence and adulthood, increasing the likelihood of delinquency, substance abuse, or difficulty maintaining relationships, thereby perpetuating the very cycle of dysfunction that began with the parent's addiction. Health risks for children of parents struggling with addiction are both immediate and long-term, affecting their physical and mental well-being. From a clinical perspective, these children are often exposed to environments that compromise their safety and health. In cases where addiction involves substances like tobacco, alcohol, or drugs, secondhand smoke and chemical residues can harm developing lungs, weaken immunity, and increase the risk of respiratory illnesses, ear infections, and asthma. Poor nutrition may also be a concern if parental neglect leads to irregular meals or unhealthy diets. Beyond environmental hazards, unsafe living conditions can arise. The presence of drug paraphernalia, unsafe strangers, or violent outbursts fueled by substance use puts children at risk of injury or abuse. Accidental ingestion of harmful substances is a serious danger in households where addiction is present, especially for younger children. Chronic neglect can also lead to missed medical checkups, untreated illnesses, or delays in vaccinations, all of which can have long-term consequences on a child's health. The mental health risks are equally significant. Continuous exposure to conflict, fear, and instability increases the likelihood of anxiety, depression, and post-traumatic stress symptoms in children. These psychological strains can also weaken the immune system, making them more susceptible to illnesses. From a doctor's standpoint, prevention and intervention are critical. Regular pediatric care, safe housing, and protective supervision can mitigate some of the physical risks. Equally important is providing mental health support to help children process their experiences and develop resilience. Without these measures, the health risks faced in childhood can extend into adulthood, contributing to chronic illnesses, poor mental health, and a diminished quality of life. Addiction doesn't just harm the individual, It creates an environment where children's health is compromised at every level. The generational cycle of addiction is a serious and well-documented concern for children growing up with a parent who struggles with addictive behaviors. From a medical and psychological perspective, children learn by observing and imitating the adults in their lives. When addiction is a consistent part of their environment, it can become normalized, shaping their understanding of how to cope with stress, emotions, and life challenges. They may come to believe that turning to substances or compulsive behaviors is a natural way to deal with problems. This learned behavior is compounded by genetic and biological factors. Studies show that children of addicted parents may inherit a higher susceptibility to addiction due to genetic influences on brain chemistry, impulse control, and reward pathways. Combined with environmental exposure to addictive patterns, this genetic predisposition creates a powerful risk factor for developing similar issues later in life. The emotional impact further fuels the cycle. Many children carry unresolved trauma, low self-esteem, and chronic stress into adulthood, making them more vulnerable to substance abuse as a form of self-medication. In adolescence, this vulnerability often manifests in experimenting with drugs, alcohol, or other risky behaviors at an earlier age, significantly increasing the chances of developing an addiction. From a doctor's standpoint, breaking this cycle requires early intervention, education, and emotional support. Providing children with positive role models, healthy coping strategies, and counseling can help them develop resilience and alternative ways of managing stress. Without such interventions, the cycle often repeats, passing the effects of addiction from one generation to the next, and perpetuating a legacy of pain, instability, and lost potential. Addressing addiction in a parent is not just about saving one life, it's about protecting the future of the children and stopping the cycle before it continues. Loss of trust and attachment issues are profound emotional consequences children face when a parent struggles with addiction. From a psychological and clinical perspective, children form their earliest and most important bonds with their caregivers, and these attachments shape how they relate to others for the rest of their lives. When a parent is unreliable, emotionally distant, or inconsistent due to addiction, the child's sense of safety and trust is severely disrupted. Trust is built when a caregiver consistently meets a child's needs, feeding them, comforting them, keeping them safe, and being emotionally available. Addiction often interferes with these responsibilities, leaving children uncertain about whether their parent will be present or dependable. Over time, this uncertainty fosters insecurity, fear of abandonment, and difficulty forming healthy relationships. The child may struggle with feelings of rejection, believing they are unworthy of love or care, which can lead to deep emotional scars. Attachment issues can manifest in different ways. Some children may become overly clingy, desperate for reassurance, while others may withdraw emotionally to protect themselves from further disappointment. These patterns, known as anxious or avoidant attachment styles, often carry into adulthood, affecting romantic relationships, friendships, and even professional interactions. From a medical standpoint, the stress caused by broken trust and unstable attachment can also have physical consequences. Chronic stress elevates cortisol levels, impairing brain development, emotional regulation, and immune function. Early therapeutic intervention is critical, focusing on rebuilding trust through consistent caregiving, emotional validation, and safe environments. Without intervention, these trust and attachment problems can follow children throughout life, influencing their ability to connect with others, maintain healthy boundaries, and form stable families of their own. In this way, the damage caused by addiction reaches far beyond the immediate moment, shaping the child's emotional world for decades. If you are struggling with addiction, remember that your children are watching, learning, and feeling everything, even if they never say it aloud. Every step you take toward recovery is a step toward giving them a safer, healthier, and happier life. Break the cycle now, seek help, find support, and choose a path that gives your children the future they deserve, free from the shadows of addiction.